for the afternoon here. Cameron Bullock is a senior at Palm Beach Atlantic University pursuing a Bachelor's of Science degree in psychology. Upon graduation, he hopes to obtain a positive working with marine mammals position, I should say. A little known fact about Cameron is when he was 7 years old, this is pretty cool, he won a goldfish. That's cool, Cam. But that's not the coolest part. All right? In a ping pong toss game. 14 years later, he is proud to say he still has that goldfish and is alive and thriving. His first an honor to be here is presenting his research entitled The Effectiveness of Dolphin Assisted Recreational Therapy Among Veterans with Post-Traumatic Stress Disorder. Welcome.
Actually, when I won the goldfish, we were afraid to name him because we figured, well, if we name him, he's going to die. So his name is Mr. Fish. All right, so for the past year, I've been working with veterans on Dolphin Assisted Therapy, seeing if it reduces or suppresses some symptoms of PTSD. So this is just kind of an insight on that. It is a pilot study. It's kind of the first of its kind, and it is still continuing. We've only had about 3 or 4 months of results. So let's get into it. Every day, 22 veterans commit suicide. That number seems high, but in fact, the real number is higher. We cannot attribute every veteran death to a suicide or a natural cause. A lot of times it's due to medications. Maybe they took too many. Maybe they took the wrong one at the wrong time. So we actually believe that number to be in the 30s to the low 50s. But the number as it stands, it equates to 1 every 65 seconds, or minutes. 53% of returning veterans have sought treatment for PTSD. We see this number rising as we are coming out of a time of war, as soldiers are coming home, and also as Vietnam-era veterans are coming out and saying, I've been suffering from PTSD for about 30 years, 40 years. This is a lot more accepting society in terms of war. So that's a really positive change. And post-traumatic stress disorder, it's defined as when an individual experiences a traumatic event. It's going to leave them emotionally, physically, scarred. They're going to experience flashbacks. They're going to go through severe depression, severe anxiety. That's just a few of the symptoms. So let's talk about other animal-assisted therapies. Now, animal-assisted therapy is not something new. It's been around for quite a while. Equestrian therapy is one of the ones that's been around the most. We see the most benefit here with children with mental disabilities, but also if you have a neurological disorder. If you have a walking disability, what we're going to do is we're going to sit you on a horse, we're going to ask you to close your eyes, and we're just going to ask that horse to walk. Because a horse's hip movements are the exact same in correlation to our hip movements. So when you close your eyes, your brain is doing the exact same thing as that horse is walking that it would be doing when you're walking. Canine therapy. This we see quite a lot in veterans. It provides companionship. This veteran has to rely on this animal to live, but the animal is relying on the veteran to live. It's a very give and take relationship. And finally, dolphin. As you will see in the slides to come, we have seen reduction in the severe symptoms of PTSD. We see a higher trust rate amongst veterans when they're with us and once they leave. But also it provides great exercise. You have a lot more mobility in the water. A lot of veterans come home from war with a lot of physical pain, and we'll talk about that in just a second. So let's talk about the facility at which this took place. Island Dolphin Care is a facility in Key Largo. It started about in 2000 with a 5-day program for kids with autism and their families to come. In 2009, they started the first ever veteran rehabilitate kind of therapy session, and it remains the only dolphin-assisted therapy for veterans in the United States. Island Dolphin Care has the ability to mix 2 already known therapeutic methods, animal-assisted therapy and group therapy. Both have empirical evidence supporting them, minus the dolphin side, and they're able to bring this into one. And then another positive thing is that all their staff are licensed and trained therapists. They're occupational therapists, they're recreational therapists. Let's talk about what the program looks like. So as I said, it's a group therapy, but what that means is we take about 4 to 6 veterans and we allowed them to bring a few family members. Only one's going to get in the water with them. We like to balance veterans returning to this program with veterans brand new to this program, because the veterans that are new to this program are going to rely heavily on the veterans that have been there before for a lot of trust, to see that we're not scary. We're not scary people. You can trust in us. So the breakdown of the day kind of goes like this. We start in the morning, we do introductions, really basic. This is where we like to set the tone for the day, really relaxed. You're not going to have to talk about your feelings here. This is going to be a place where you can just come have fun, don't talk about anything. But if you want to, we're here and we're willing to help. We move into artistic relaxation. This is where we just paint with them. We paint t-shirts, we paint paintings, we paint pillowcases. It's just a fun time for them to ease into the situation, for them to realize that this environment is not going to be a stressful one. And then a barbecue. Now, it seems silly to highlight something as small as a barbecue, but many of these veterans have not eaten in 2, 3, 4, 5 days. They are so mentally and physically bogged down by this disease, PTSD, that they just don't eat. Just a basic function, they just don't find a need to do it. So this is where we see group therapy really come into play. These veterans that for their first time coming are going to watch these veterans that are returning to this facility. They're going to watch them eat. They're going to get a really positive feel. It's kind of monkey see, monkey do. When the new veteran can watch the old veteran do something, it's going to provide a lot of positive feelings. And then we move into the structured dolphin swim. And then the activities of the day, they're individualized to fit each participant's need. I imagine most of us in here know what it's like to change around an interaction because something happened that we weren't expecting. The majority of these times, these veterans are coming with physical pain. We often see veterans that are missing arms, that are missing legs. We have to adapt our program to that kind of on the spot. Maybe we don't know that before they come. So this is a dorsal pull. Jordan, you know what that is. We were going to do a foot push, but his Humvee was over an IED when it went off, and it scarred his legs. His legs were not strong enough to do a foot push, so we had to change our program around. Having therapists there, having the full-time staff therapist there, takes a little bit of pressure off the actual trainer and a little bit of pressure off of the veteran as well. This is a participant. He had a bit more emotional needs. He had trouble trusting things. He felt distance from his family. So with him, we're gonna build a program that's a lot more trusting. We're gonna give him the opportunity to ask the dolphin to do something. And when that dolphin ultimately does what he asks or doesn't do, the veteran has put its faith in something, its trust, and the dolphin fulfilled his trust. These veterans haven't felt trust with their family members, with their friends in years, but they can find trust in a dolphin. And it's always funny to me, these guys, they don't look at dolphins as animals. They look at it as an unjudgmental, an unbiased, this amazing creature that can relieve all this pain that they're feeling. So it's quite awesome. Let's talk about the study. We collected data using pre- and post-test evaluation techniques. So what that meant was, when they get there, I gave them a survey, which I'll show you on the next slide, and it pretty much assessed different variables of PTSD. How have you felt in the past 12 months? Tell us how you felt. So they fill that out, and then we say, how do you feel today? Then they go through the entire day, the artistic relaxation, the barbecue, the swim, and then we ask them afterwards, okay, now how do you feel? So we had started the study about a year ago. We were actually put on hold by the Department of Defense, and we just got clearance again in July. So since July, we've had 18 participants. Our average range of age is 33 years old. That's expected with the younger veterans that are coming back from the war. But a big number is the 53% that have come to this program before and want to return. They want to see that their program is effective, not only empirically with statistical data, but also qualitatively with the veterans' opinions, with their interviews. So this is what the survey looks like. It's broken down into two categories. We have mental pain and physical pain. We highlight some, just kind of the main things, but there's also some things where it's really hard to see that a veteran circles severe. Need to consume drugs, need to consume alcohol. These aren't prescription drugs that we're asking them about. These are illegal drugs that we're trying to ask about. Physical pain. It's hard to see it when all those numbers are circled severe. That you know this veteran is really weighed down. Okay, so for our 12-month base mental average, we took all the numbers and we averaged it out. It's 2.84. That puts it right in between minor and moderate, more towards moderate. After the swim, it went down to 0.48. That puts it right in between none and somewhat. That's an 84% reduction in mental pain. In our physical average, for the past 12 months, it was 1.9. Put it right at about minor, and then after the therapy, 0.3. That puts it closer to none than anything. And that's a 93% reduction rate. We wanted to highlight some of the biggest reductions that we saw, some of the symptoms that are really going to weigh the veteran down. Those two biggest ones are depression and anxiety. So our 12-month average on depression was 3.2, puts it right around moderate. After the therapy, it was 0.3. And then for anxiety, our 12-month average was 3.5, and after the therapy, it was 0.5. I also really wanted to highlight some things that we didn't see a whole lot of progress in. Now, hypervigilance is a word that is big around the veteran community. It's where you're so tuned into the environment that you're jumping. Guys that suffer from hypervigilance are the people that are going to drop to the ground when they hear a car backfire because they believe it's a bomb going off or a gunshot. This is one of the hardest variables of PTSD to see any reduction in. So before our facility is that I get to talk with these veterans, I get to interact with these veterans. So I just wanted to highlight one sentence, and that's the very last one, and these 3 words, they get me every time, so bear with me if I choke up a little bit. And those first 3 words are just, I feel joy. A lot of these veterans, they do so much for us, and they come back, and we are able to provide them with something as simple as joy. They haven't felt joy in so long, but when they interact with these animals, they feel joy. He continues to say, it allows me to draw on the memories with the dolphins for the future when I see pain. Now this is interesting. He's saying that in the future, when those symptoms become unsuppressed, when he starts getting depressed again, when he's anxious again, he can relive those memories in his mind and find that it reduces those symptoms. So that's something we hope to kind of access here in the future. Right, so as I mentioned earlier, there was an 84% reduction rate in mental pain and a 93% reduction rate in physical pain. We accredit a lot of the success to Island Dolphin Care's ability to incorporate group therapy with animal-assisted therapy. I know I mentioned earlier that Island Dolphin Care was the only facility in North America that has a veteran therapeutic center or facility. Why I say that is there are a lot of veteran interactions going on, and those speak wonders. This is just, I say that it's a therapy because trained and licensed therapists are the ones that administer this. They don't come to a dolphin facility for a dolphin swim, they come to a therapeutic facility for a dolphin swim. And then because this is one of the only therapeutic centers with dolphins, we had to look at the entire program. So these surveys reflect the entire day, the artistic relaxation, the barbecue, and the swim. In the future, we hope to have a control group by just breaking down the barbecue and the artistic relaxation versus the swim. We'd like to get a little bit more data, kind of play into that, because I do feel that this assessment is the assessment of the program, so I can't say that this is purely a study on the actual interaction with the dolphin. We will continue data collection until May of 2015, and then we want to increase the number of post-assessment periods. So when they leave, I want to give them a packet, and I want them to fill it out a week later, 2 weeks later, and a month later. Pretty much the exact same thing. How are you feeling now? We want to measure how long these symptoms stay reduced for, and then ultimately, we want to figure out a way to keep them to stay reduced longer. But the thing is, when these veterans leave this facility, out of sight, out of mind, they relapse. They go into a stage of depression. They go into constant anxiety again. They won't return our phone calls. They won't return our mail that we send them. So it's hard. This is a challenge we're having to overcome. It being a pilot study, it being one of the only studies of its kind, we're running into obstacles. There's no benchmark for this. We hope to add a physiological portion. We want to measure heart rate, blood pressure, before the swim, after the swim. In the psychological community, it would speak wonders if we can say that this both works to reduce the symptoms, but also for physiological variables. And then I know that there's a lot of talk about other veterans interactions starting up, or even some veteran programs. I hope to see other places adapt this kind of research, this kind of survey, because it speaks wonders. It's easy to write grants when you have statistical data backing up. I just want to say two things before I end. A lot of us in this room have the ability, have the facilities to create a therapeutic session like this. And I think it would speak wonders if the marine mammal community got behind veterans and said, look, you're fighting for us. When you come home, we are here for you, because there's not a whole lot out there for them right now, and they feel helpless. And also, if you or anyone you know suffers from PTSD, please don't hesitate to stop me at the conference. I can give you my business card, I can get you in contact. Contact Island Dolphin Care, contact the Miami Veterans Association, because for the first time ever, we can say that PTSD can be reduced by a dolphin interaction program. Thank you. So I have 2 minutes if anyone has any questions. Anyone? Oh, yes. Okay, wait, someone's running a microphone to you.
Hi, I thought that was an incredible presentation. My name is Carrie Goodbar, and I was wondering if you had examined, you talked about some of the benefits with other animal care treatment options with other disorders. I was wondering if you had examined any of the programs with animals, specifically focusing on PTSD, if they were just as effective in diminishing those symptoms, or if it was just the dolphins specifically.
That's a great question. I did over the summer, I did work, I volunteered, I guess 2 summers ago, with equestrian therapy. There is already evidence to support that it is as effective. We see a little bit more in kind of the harder, like hypervigilance. You don't see a big reduction in hypervigilance when it comes to equestrian therapy or canine therapy. So dolphin assisted therapy is right on par with the depression, with anxiety. However, when it comes to more severe cases, hypervigilance, need to consume drug, thoughts of suicide, we see a bigger reduction in those. And I have time for one more, I'm being told. Oh, there's one.